Good afternoon. Here to update everyone on the latest on the coronavirus COVID-19 response. Thus far in Florida, there's been 18 positive cases. 17 of those have been Florida residents. 5 of those had been diagnosed and isolated in another state. So by the time they come back here, they're going to be free and clear of the virus. And we have had 2 fatalities of folks who were elderly and then had serious underlying health conditions. We do currently have 115 tests that are pending results. We've had 140 tests come back negative. 802 people have been fully monitored, and 302 are currently being monitored. Now, we did have recently 3 individuals test positive in Broward County. So far, the epidemiological investigations have discovered that 2 of those cases are actually linked. They were both working at the port. And just what that means is, in order to have quote community spread, you would need 2 unlinked cases. So right now we only have 1 unlinked case in Broward County, but obviously that investigation is ongoing. There were 2 cruise ships. I met with the Vice President this weekend with the cruise liner industry. I know that these cruise ships have been a significant issue, both because of the close quarters that people travel in, but also the amount of resources it takes when you have different incidents like we've seen. So we did have the Regal Princess, and there were 2 crew members who were considered high risk. And so they were both tested for COVID-19. Now, neither were ever symptomatic, and they both did test negative. So the CDC has lifted their do not disembark order on the ship, and passengers are being disembarked. The second ship is the Caribbean Princess, which is set to dock at Port Everglades on Wednesday, March 11th. 2 members of the ship are considered high risk. They are isolated, but they are currently not symptomatic. As they get closer to shore, samples will be collected, they'll be tested, and so the CDC has a do not disembark order on that ship pending those results. I was able to meet with the president today and thank them for their support for our efforts here in the state of Florida, particularly for coming out early and restricting travel from China. I think that did make a big difference, and now some of the other areas, Italy and whatnot, they've responded, which we appreciate. We also had another conference call with the governors and Vice President Pence and the coronavirus task force. We appreciate it. I think that the overall messaging in terms of what we're seeing is that this is a virus for the vast majority of individuals, will not lead to serious health complications. However, it's pretty clear that as people get older, and particularly those people that have a serious underlying medical condition, those are the people who are the most at risk to have serious negative consequences from this virus, including death. And so we've made it a point to make sure that we're working, and Mary Mayhew is going to talk about doing things with our nursing homes and our senior population. But there has been updated travel guidance over the last several days from the CDC. Dr. Fauci today, said, look, if you're elderly, you have a serious underlying medical condition, don't get on a cruise ship right now. You don't take a long flight where you could be exposed, to the virus. Take certain steps to do what they call social distancing. If you don't feel good, stay at home, avoid large crowds. And again, that's because that population is the most at risk of having serious consequences from this virus. SEMA Verma announced that they're going to be doing more on nursing homes, but I'm happy to say, Mary Mayhew has been on this for a couple weeks. They're visiting nursing homes, particularly those who last year had incidents of infections that were higher than normal, or any types of problems. ACA is sending people there, and obviously I think these folks know who they're letting into these facilities is going to be very significant, and you want to make sure that you're doing it right. So I did direct Scott Rivke. I Scott Rifkes to declare a public health emergency. I guess that would have been last week. We also directed the Division of Emergency Operations to activate to level 2 to increase coordination among state agencies. We did that this week. I am going to sign, or I actually just signed before I came in here, a state of emergency declaration. And the reason why we're doing that is that allows us to create a unified command structure. It also allows, if need be, out-of-state medical personnel to operate in Florida. It allows us to more swiftly purchase any necessary supplies, including masks and materials and equipment necessary to set up field hospitals. It allows pharmacists to dispense up to 30-day emergency prescription refill of maintenance medication. Now, I have not had any requests, and I've told all these agencies, if you need something, let me know. But we figured that will come eventually, so we'll be in a position that we'll be able to mobilize our resources more effectively as a result of that. I've talked with Dr. Rifkes about the testing capabilities here in the state of Florida. Now, anyone who's fit the criteria, they've been able to test, currently doing testing at 3 different state labs, Jacksonville, Tampa, and Miami. But we also now have private laboratories that are starting to test individuals. So both LabCorp and Quest are doing that. If a physician refers it there, then they will test that. And obviously, we will get the results of that. So I think that that's positive. The Florida Department of Health is also working to get all, quote, CLIA certified labs in the state of Florida to be able to begin testing. Again, that just increases the capability if we have a situation where you have a surge. I also talked to the head of the Food and Drug Administration. Some universities have been able to design their own test. And what I asked is if we have universities here who are interested in doing that, that they move swiftly to be able to approve those or at least look at them to see if they're effective. And they understood the urgency of the situation we find ourselves in. So they pledged to us that they would move very quickly. And so that's another potential source of testing. I also asked Dr. Rifkes to look at, I think if you look at this, one of the concerns is how this affects people who are younger and the types of symptoms that people have when they get infected. And a lot of the people who are younger seem to have very, very mild symptoms. And the problem with that is that may not be someone that's going to present to a doctor's office because it's not something that you think is a huge deal. So the state has access to different data from different hospitals, emergency rooms. And so what Dr. Rifkes and his team have looked at is, has there been a spike in any areas of the state where people are reporting flu-like symptoms when they go in that's not even connected to this? And then trying to drill down, are there cases that are just simply under the radar? So they're doing that. I've also talked to them about looking at their pediatric evaluations. Now, what they typically do now is they will have kids, when they come in, get swabbed, then they'll send that for flu, to be able to try to figure out how prevalent flu is in the population. They're going to be looking at potentially doing that with COVID-19 as well, because I think if you can try to get a sense of who's carrying this that really is very mildly symptomatic, that could be very, very helpful. And then you can even potentially, they're going to look at ways of expanding that. So as individuals are coming in, they'll have an ability to get swabbed, send it in, and then try to see if we can pick up some of these cases. So that's something that's ongoing. But I think it potentially, could help, particularly for the class of people who are not going to develop really significant symptoms, but nevertheless potentially be contagious. In terms of funding, I've requested $25 million to be appropriated for this year for the Department of Health so that we can immediately use it upon signing of the budget. The funding will be used for lab supplies, personal protective equipment, additional statewide staff to expand capacity to investigate and monitor individuals who are infected and those at risk for contracting the virus, as well as enhanced communication to the general public, healthcare providers, and visitors to our state. I think that the legislature has received that request warmly. I think the leaders in both chambers understand that this is something that we have to deal with, and it's better to be prepared and have the resources than have to be shortchanged. So I appreciate that. I also appreciate Congress passing the $8.3 billion response package. We think we'll get at least $27 million here from the supplemental bill, and hopefully more as we continue with our efforts. I've asked Jared Moskowitz, of course, he's organizing, all the state agencies. I've also asked him to have people, that he's working with in the EOC from these different key industries in our state, like the nursing homes and healthcare providers. And so he's been working to do that, and I appreciate that. And I think that, because at the end of the day, you're going to have federal government have a role in a lot of this. The state, we have a role in a lot of this. The counties have a role in this. But you also have private hospitals. You have the private sector. Really, everyone is going to have one form or another to do something here. Secretaries Mayhew and Purdom have been aggressively reaching out to nursing homes to ensure compliance with appropriate protocols. And as I mentioned, that includes on-site inspections, particularly at nursing homes where you've seen cases in different counties of COVID-19, and then also those nursing homes who may have come up short. And the criteria is rigorous, as it should be, but those are places where they're looking at very, very seriously. Richard Corcoran, I'm going to have him come up too and just say a few things about communications with the school districts, the universities. Richard is working on, he's got contingency plans in the case you need to do any type of virtual learning. He's got a plan to do that, which I think is good. We've also been coordinating through Secretary Thibeault with our ports and airports to ensure the state is offering all the assistance it can as they deal with travel-related issues. And then Jim Eifert, National Guard, they stand ready to help. Obviously, they can do a lot in terms of logistics. They do have medical personnel as well, and so they stand by ready to go once that request is made. The private sector, I mentioned that they play a role in this, and we've been telling employers, if somebody is experiencing symptoms, it's much better for them to stay home, follow the directives of either the local health department or their physician, and then come back to work when we know they're healthy, because if they come in and infect people, that ultimately is going to be worse for your bottom line. And for example, we have Darden restaurants here headquartered in Central Florida, and they're going to do paid sick leave for their employees. And I think you're going to see more and more businesses respond. I know the president's having a meeting with some of his advisors in the White House today, trying to figure out what they can do in terms of the economic effects that this could have. We have some limited ability to help folks who are self-isolating when they have loss of income, but I think it's going to require the private sector to be involved in addition to the state and federal government. So I appreciate what Darden has done with that. We stand, ready to continue fighting this, but I would just stress, this is. And when this first started in China, it wasn't clear. You see all these different pictures about what's going to look bad. But as this has progressed, you really do get strong data and a strong picture of a virus that disproportionately will affect folks who have serious underlying medical conditions and who are elderly. And as you get older, it seems you're more at risk to have serious complications for this. So people should just keep that in mind. They should make sure that they're protecting themselves. Avoid, if you're in that category of individuals, avoid things like cruise ships, long plane flights, large crowds. Do the types of social distancing measures that can really make a difference. And finally, I would just say, if a lot of people who could potentially get this, I think the data has shown, are not at risk for serious complications. However, those are the people that really are going to probably play the most significant role. If you're doing things like washing your hands and staying clean and doing things that the CDC said, all you need is soap and water. People say you need this hand. Soap and water is the best thing that you can do. So if you're doing that, that will make a difference. And it may not make a huge difference for you if you're young and healthy, but it potentially could make the difference as to whether that virus eventually infects somebody who's not going to be able to deal with it quite as well. So please take the precautions that you can. With that, we're going to hear from our Surgeon General.
Thank you, Governor DeSantis. I'm going to begin by thanking Governor DeSantis, Lieutenant Governor Nunes for their incredible support, along with fellow members of different state agencies. So as before, the Department of Health remains firmly committed to protecting the public. We have a very large response involving hundreds and hundreds of individuals to keep Florida safe. To touch on a couple of points that the governor mentioned in terms of testing, we now have commercial testing that is available in 2 laboratories, In addition, the FDA has approved kits that can be used by CLIA-certified laboratories that can detect COVID-19. What this means is that laboratories across the state, when they get these kits up and running, they will be able to test, which is important for the public. As the governor mentioned, this is a virus that disproportionately adversely affects elderly individuals and also those with underlying conditions. So this is why this has been a major focus of ours, getting information out to nursing homes about individuals, how they can protect themselves. I do also want to comment on hospitals. We have a lot of frontline hospital workers who are playing a tremendous job in terms of evaluating individuals with COVID-19. We are working with these hospitals to make sure they have the resources that they need and also the guidelines that they need to make sure that they are protecting their workforce. Our current strategy has been containment because at the present time we do not see community spread, which means that if an individual has COVID-19, we'll identify their contacts and make sure those individuals are isolated so they can't spread it to others. But as you've seen what happens in other states, there is community spread in different states right now. And for preparing for this eventuality, this is something that we are very much focusing on in terms of mitigation strategies. And then also, as the governor mentioned, protect yourselves. If you see somebody who is coughing or sneezing, step away. If you're coughing or sneezing yourself, cover your cough. And most of all, if you are ill, don't go to work or go to school. Thank you.
Richard? Schools?
Just echoing what the governor and Surgeon General said, we continue to coordinate and communicate with all the districts. The superintendents have been fantastic and great leaders in their districts. All those things that the Surgeon General and the governor just said, including enhanced cleaning, if you're sick, stay home, all of those things are being implemented by the districts. We continue to recognize that we're at low risk. We continue to recognize, as the governor has said, that children are in many cases, whether it without any kinds of problems or whatsoever, and so that's a good news for parents. And we also continue to be completely prepared. We had another call with the virtual school today. We'll have capacity here in the next, probably it'll grow day by day, but we'll have capacity probably for a total of 400,000 over the 40,000 we have now, full-time students in the virtual school. We've ordered 15 new servers. In addition to that, we have trainers of how to get on the virtual school with existing teachers. We'll have training of an additional 10,000 teachers here in short order, hopefully in the next 15 to 20 days, and have that capacity for 400,000 students. We don't think that's going to be necessary. We think we're doing a great job with working with our superintendents and keep creating that containment. If a child's sick, word is out, stay home. Don't come to school. If there's exposure for someone that has symptoms and they have exposure to a level 2 or level 3 situation, those are going right to the Department of Health. And so I think we're doing a great job in terms of working with our districts in containment and maintaining so far 100% of our instructional hours, and I think that's going to continue. Thank you.
Thank you. We have been working closely with the Surgeon General under the leadership of the governor to communicate consistently with our healthcare providers, with hospitals, with nursing homes, with assisted living facilities. We have had over 2,500 providers participating in these calls. We have had laser beam focus on the care provided to our elderly in this state. It is important to stress that infection prevention and control is foundational to the work in hospitals, nursing homes, and assisted living facilities. We have been working with those providers throughout the state to reinforce those protocols, those best practices. We are particularly focused today on making sure that our hospitals, our nursing homes, our assisted living facilities are screening visitors, employees, and vendors. They are screening for illness, if anyone has traveled internationally, and certainly more recently, if they have been on a cruise ship. They are being given all the tools and resources, standardized signage to support their efforts to protect their residents and their patients. We are also, as the governor said, prioritizing our on-site inspections to make sure that we are able to support the adherence to the infection prevention and control protocols that we expect, that today we know are well-established best practices in hospitals, nursing homes, and assisted living facilities, that they today and have always drilled on and provided training on for their staff. So we will continue to be diligent in our efforts to support all of our healthcare providers as they continue to enforce these protocols in the best interest of protecting their patients and residents. Thank you.
I also, just because I was able to speak with the president, I did discuss a few issues pertinent to Florida. I discussed the need for the Army Corps to move faster to permit the reservoir at the Everglades agricultural area. I talked about the Space Command and the Combatant Command. We want that to be in Florida. And I think it is going to come down to Florida and Colorado, and I think even the Air Force is looking more favorably at Florida, even though they have a strong preference for Colorado. And then I mentioned there's an FDA regulation come down that may have a negative impact on premium cigar makers in Florida. Look, it's a lot of family businesses. So he understood that, and I think he wants to continue to work with us on not only COVID-19, but across the board. Mike?
Are you making any changes to your travel plans, and if so, what might they be?
I have not, but I think that if you look at how some of these things work, I think you're going to start to see things just change naturally. So, for example, I'll get invited to speak at different things. Perhaps there won't be as many of those things happening in the very near future. And I think, different organizations look at that, and they got to make the best decisions that they can. That medical conference that was canceled in Orlando, actually, I think the president and a lot of his administration was going to go. You had a lot of people involved in the medical industry, so if there happened to be one person, then you have to self-isolate anyone who had been in contact. Kind of takes people out of being able to be in this fight. So I kind of understand why they're doing some of this stuff. And so, so we'll see. Obviously, we've got a lot on our plate here, not only working on this response, but as you all are well aware, we have a legislative session that's coming to a conclusion over the next week or so. And so we want to be working well with the legislature. I think the legislature is doing a lot of really good things, and my hat's off to to Bill Galvano, Jose Oliva for really working hard. But I think we can have another fantastic session.
You talked about the surge. You mentioned the surge, and I'm wondering, what are you doing working with hospitals to make sure that there is capacity both in the ICU and just generally in their staffing?
So all hospitals, they have to have plans for an eventuality like this. At the same time, kind of the best laid plans can sometimes go out the window as soon as something happens. And so this is something that we would be potentially using some of the emergency resources for to help surge personnel if need be. General Eifert, we've talked about potentially having a field hospital if there's an outbreak. The thing about this is the vast majority of people who get infected will not require hospitalization. And so to have them use hospital resources, so we're thinking about, is there a way that we can assist to set up a way for that people can be tested, treated, isolated, but not to take up all those resources. And so it's a concern I have. And now Secretary Azar, when we did the call with the task force today, said that in China, they actually would, if they had a number of hospitals in a given area, they'd actually take one hospital, say this is the coronavirus hospital, and then only do that there and then have everyone else go in the other ones. We obviously are thinking about that, and that's a best practice now that I think they're recommending out of that, but there's logistical issues involved in that, and that's not something we could dictate really at the state level. I think that it would be up to a lot of the local folks. So there's a lot of different options, and if it comes to the point where, there is an outbreak in a given area of Florida, we want to do. But that was one of the reasons why I wanted to do the state of emergency. I wanted Jim's folks to be deployable if need be, and then I wanted to be able to contract additional professionals to come in if there's a shortage somewhere in the state.
This morning, your Department of Health sent a news release that is erroneous to the media, telling people who traveled internationally to quarantine for 14 days.
They meant, yeah. So it was really supposed to reference the countries that have been identified. And so if you've traveled from China, if you've traveled from Japan, South Korea, Italy, or Iran, those are the countries where we're asking people to self-isolate. Now, there is, I think, given this virus is spreading in different parts of the world. Certainly, if you're, elderly or have a serious underlying medical condition, think twice about international travel. I think that there's a lot of risks involved for you, but that was supposed to reference those 5 countries.
Is that kind of mistake acceptable?
Well, no. I mean, I think you got to be very clear when you're doing this. And I think there's a lot of different things going on, but at the end of the day, those are the countries where we've identified outbreaks. The self-isolation, I think, is very appropriate. That guidance can change as the facts on the ground change and as different things develop. But I think the main thing is we really want to get the message out about the folks as they get older and as they develop serious underlying conditions or have those, those are the folks that really need to be protected. They got to obviously take precautions themselves, but then everybody else, needs to be doing things as well.
Can you address the testing rate? The number of tests that are being performed each day seem to be on the low end, and also the number of test kits that are actually available that were given to Florida from the CDC.
Scott, how do you want to do it? You want to do it? Okay, yep.
Thank you. So in terms of the number of testing kits, let me explain it. So when we receive testing kits from CDC, those test kits have been sent to our 3 laboratories, one in Jacksonville, one in Tampa, one in Miami. Based on the material in the testing kit, then we can test a range of individuals that meet that criteria for testing. So that is how the testing kits work.
Can you give us an idea of that range? How many testing kits have you gotten, and what's the range?
Yes, I can explain it. So we are continuously finishing our queue. So when we receive tests in the labs, we are running those tests typically the same day. Sometimes tests come in at night, people take specimens, and then those tests can be ran the next day. So we are updating the website every day, floridahealth.gov/COVID-19 with the numbers of updated tests that are completed every day.
But can you talk to us, please, about the numbers? I thought I heard the governor say he was expecting more tests to come in and that more commercial, I understand LabCorp is doing it, but
Yeah.
Can you give us a sense of how many tests, in the terms of numbers of tests, not how many test results? I think last week the governor said tens of thousands. Have they arrived? Are they going to commercial providers?
Yeah, so LabCorp and Quest have the ability to do tests in addition to the tests that can be done at the labs. And for clarity, we have enough tests to test all of the samples that we're receiving in. We're not on a shortage, and we increase capacity today by having LabCorp and Quest do the test. So there is not a shortage of the ability to test for COVID-19 in Florida, and those commercial labs coming on board today will provide us with additional tests if we have a surge. But to date, we even had tests to do whatever tests that have been requested of the department.
Have the tens of thousands?
So yes, can you just, there's test kits being shipped, I think. Can you
Yes.
give a sense of that?
So we have ordered additional tests for our public health laboratories. We expect those test kits to arrive so that we can continue to run the specimen. And just for clarity, this is what happens. So if an individual comes into a healthcare provider and they meet the criteria, or that healthcare provider deems it necessary to have them take a test, they can either have that test tested by our public health labs or a commercial lab, and what happens is they take a swab of their nose, of their mouth, and sputum if available, and then they send that off for testing, and that's how the process works.
Are we going to take a second look at the budget? Do you think it was fair for Senator Scott to raise questions about the information that's been released so far?
Look, on these things, I mean, people are gonna chirp. It is what it is. But in terms of that Lee County issue, that was an individual who had passed away, and then the test result later came back positive for COVID-19. And so as soon as that happened, I think that happened on the Friday evening. Then that was put out by the Florida Health Department the same evening. And so the idea that somehow there was like a positive and then the person died, that's just, it was totally false. And so that's just the facts. And so I just, what I want to do is put out the information, but the information needs to be accurate.
What's the policy putting out that
We're
information,
looking at
sir?
the economic uncertainty and are looking at making some budget adjustments. And President Galvano said that they might be looking at doing a haircut on teacher raises. Do you think this is still going to be the year of the teacher?
Oh, I think it needs to be. That would not be the place. I think that would make sense. I think we can do this. I mean, the 30 billion or the 25 million that we're asking. I mean, that's important. That will really help Scott and his folks to respond. But at the end of the day, I mean, that is not a huge part of a $91 billion budget. And so we can absolutely walk and chew gum at the same time. So I think we're on the cusp of really doing a lot for teachers. And I think we just, it's on the 1 yard line. Let's just punch it in the goal line or punch it in the end zone at this point and not walk away from that. So, and I think that that's what will happen. I think we'll get there. We also are getting some federal dollars. And then through my emergency declaration that we issue, I'll have the ability to be able to do some contracts. And we think that some of that it will be reimbursable based on the federal supplemental. So it's a similar dynamic to like what we do when we do hurricanes. When we were gearing up for the hurricane last year, Jared's doing all this stuff. We're getting ready, all this stuff there. Thankfully, it didn't end up hitting us, but a lot of that stuff we were able to get reimbursed from the federal government. So,
Two more questions.
Governor, on the economy,
yes.
what role will your concerns about the economy have in your decision-making on how to proceed from now on?
Well, I think when you're looking, primarily because we haven't had a lot of unlinked cases in a given area, we've been following a containment strategy. So identify where someone would be positive, trace the contacts, isolate the people so that the virus doesn't spread. At the same time, Scott and his team, they're laying they're starting to implement what are called mitigation measures, and that's assuming that you have a cluster or you have community spread. Then how is the response differently? And so when you get into a community spread situation, you have various levels of what medical professionals call social distancing. So it may mean you don't have as many large-scale events. It may mean you have an impact on things like the schools. Those decisions, I think, are primarily going to be driven at the local level. I think we will offer whatever support and input, but I think a school district's going to be best to understand, what they want to do. I think folks, cities and counties that host large events will be in a better position to know. And so Scott will be engaged, the health professionals will be engaged, CDC will help out and offer guidance, but ultimately they have to do it. Now, how does the economy do? Is, well, if you do things that really aren't going to be effective at stopping the virus from spreading, but then will have a negative impact on the economy, those are people's lives you're talking about. I saw the mayor of Broward County when we were meeting with the vice president. And, the cruise liners provide a lot of jobs for his community. And so, I think he wants safety and everything like that, but at the same time, there's a lot of people that really depend on that. And so you need to be conscious, that there are people's livelihoods at stake on how these things go. So my hope is that we continue to address this aggressively. As you go into mitigation, to the extent you see clustering or the extent you see community spread, that those measures can be undertaken in the way that's most effective and does the least disruption as we can. But these things, this is a fluid situation, and I think you got to be willing and able to respond accordingly. But this is going to be a team effort. It's going to be a bottom-up effort, and we're going to be working with local communities. We're certainly not going to be dictating the decisions that they make.
But have you had conversations with theme parks and
One last
UCA
question. I just wanted to follow up.
Sure.
You talked about cluster areas, and that raises some questions. That people are already finding that nursing home staff is reluctant to come in. What are you doing about testing and isolated screening of healthcare workers and making sure that people are safe going into these facilities?
Well, Scott, you want to address that?
Yeah, thanks for your question. So first, for nursing home facilities, assisted living facilities, we have a screening tool that we have developed and have pushed out. So if a visitor comes there, do you have a fever? Can't visit. Are you sick? Can't visit. Have you had international travel within the past 14 days? Can't visit. Have you been on a cruise? Can't visit. I want to emphasize that this virus is transmitted person to person, so by intersecting potential transmission, that's how we do it. And hats off to Secretary Mayhew and her agency, who is having visits at these facilities on a regular basis to make sure that they're informed. And we've had regular phone calls to make sure that everybody is aware. Thank you.
Thanks.
Thank you. Thank you, everyone.
Is there a way we could ask Dr. Rifkin another question?
Commissioner Corcoran. Commissioner Corcoran, can we ask you?